హెల్త్ కేర్లో కొత్త పోకడి కొత్త వచ్చిందంటే స్టార్ట్ చేసింది మనం 7 స్టార్ట్ చేసుకోవచ్చు. వెదర్ ఇట్ ఈస్ కిడ్నీ ట్రాన్స్ప్లాంట్, వెదర్ ఇట్ ఈస్ హార్ట్ సర్జరీ, ఎనీ ఎమర్జెన్సీ కేర్ కానివ్వండి, క్రిటికల్ కేర్. వన్ ఆఫ్ ద బెస్ట్ క్రిటికల్ కేర్ వీ హ్యావ్ ప్రూవ్డ్ ఇట్ సిన్స్ 34 years. More than 60 beds are occupied and given a best care. Anytime any emergency comes, we are there as a team of expertise, emergency and intensive care unit.
And working together with other pediatric hospitals close by, and we should be able to provide that both for adults and for children. And like Commander Bose was saying, I am not a foreigner to Vizag. When I first came to Vizag maybe 8 years ago, the person who met me at the airport said, Professor Cherian, welcome to the city of destiny. So I think it has proven to be a city of destiny. We did the first liver transplant here. We then, maybe in 2017, our team did the first living donor liver transplant here. So Vizag and I have been associated for a long time. I'm very happy that we are privileged to associate with Seven Hills, because it's got an excellent reputation, it has got a beautiful location, it's convenient for patients, and I hope that we can make a difference. But this difference is not made by one person, which is precisely why I asked Dr. Babu to be here as well, Dr. Murali Krishna to be here as well, because there is cancers, there is cirrhosis, there is encephalopathy, and the treatment of each of the parts of this disease requires an amazing member of the team. Dr. Babu is one of the most experienced intensive care doctors in the state. Having him look after an acute liver patient will make a difference in the outcomes. As you know, Dr. Murali Krishna is the director of Mahatma Gandhi Institute, one of the premier institutes for oncology care in North Andhra Pradesh. And with their institutes, the ICU expertise, Dr. Vishwanath is the gastroenterologist here, his expertise, I am hoping that we can amazingly change outcomes for liver disease in Vizag. Maybe about 5 years ago, there was a newspaper article from Vizag, and I am very proud of the title. And the title simply said, Vizag transplant rates equal the West. And I think if we can achieve that, we'll all be quite satisfied. Thank you.
It's a very momentous occasion for all of us, because we are reaching a milestone in having a collaboration in one of the best institutes in liver transplant, and I would say the only private liver transplant institute which is exclusively catering for cancer in liver and the liver transplantation. South Asian Liver Institute based in Hyderabad. The founder member, Dr. Tom Cherian, Professor Dr. Tom Cherian, is a very, very renowned liver transplant surgeon in India and as well as abroad. He spent a long time in UK, in many of the renowned institutes and hospitals, and thereafter he has come in India and opened the South Asian Liver Institute. But before that, he has worked in many other hospitals, and he has done about 650 liver transplantation, and which includes about more than 65 of children in liver transplantation. So it's a proud privilege for Seven Hills Hospital to have a collaboration with such a renowned and a reputed institute, our South Asian Liver Institute. And I am more than also happy that Dr. Murali Krishna, who is such a renowned person here in the field of cancer and with this hospital, is also standing by us as a matter of strength of support. So this is a very momentous occasion. Dr. Kuchila Babu, who has been since the inception of this hospital, is here. He would know very well what this moment means to all of us in Seven Hills Hospital, especially when we are reaching a milestone. And with this, I think that this is the time that we need to celebrate. We need to, commemorate this particular day, because this is what we are reaching a milestone. And this particular step that we have taken in collaborating with South Asian will go a long way in taking care of patients who have been in search of a good institute for liver transplantation. Though a few years back, Dr. Tom had come to Vizag. He used to come to Vizag to do a lot of liver transplantations, but that subsequently stopped, and this is a new beginning again for Dr. Tom to come back and have a collaboration with his institute and our institute. So I think this is a very proud moment for all of us. We should be happy for the people of Vizag, the neighboring districts and the neighboring states to get a collaboration like this, and it will be a very, very proud moment for the people of Visakhapatnam and the other areas that, and feel happy about that, this is what Seven Hills Hospital is going to start and give them a new beginning in the healthcare industry. Thank you very much. With this, I hand over the mic to Dr. Tom to say a few words about the South Asian Liver Institute and this collaboration with Seven Hills Hospital.
Good morning. So the first thing to say is that this meeting is not about us. It's not about Seven Hills. It's not about South Asian Liver Institute. It's about nearly 30 million people living in North Andhra Pradesh who don't have a state-of-the-art liver center. So, as you know, Seven Hills Hospital was one of the first and best corporates to start nearly 30 years ago. And I have been working in liver transplantation for about 25 years now. So I worked for about 17 years in London. I did about 350 to 400 liver transplants in London before I came back to India. And now we have done about 300 transplants in Hyderabad over the last 7 to 8 years. My point is, this great hospital, Seven Hills, and the experience that we have in transplantation from all these number of transplants is now being brought to the patients of Vizag and not Andhra Pradesh. I think that is what is newsworthy. I want to highlight that young man sitting at the back. Please come up, Balaji. So many people think that we are a transplant unit. Please. But I want to give you an example of Mr. Balaji. He is a successful entrepreneur and he's here in Vizag only because of his friendship with me. He was transferred to our hospital nearly 6 years ago in a comatose state. And everybody said he needs a liver transplant. But because I had worked in King's College London, and because we know that there are many people who recover from acute liver failure, and there were some signs that he was one of those people who can recover without a transplant. Without a transplant, with minimum of cost, he was sent home and he is still well and not on immunosuppression, and the 20 lakhs is still in his pockets. So my point is, in order to achieve this, you need experience. Because a less experienced team would have said, oh, he's going to die, let's do a transplant. It is only because of the experience of 10 years or 20 years we realized there were some signs in his liver that it is going to come back.